At the Ortho Show, we are proud to partner with Shoulder 360. Today's episode of the Ortho Show is sponsored by Shoulder 360. Shoulder 360, the conference, provides a comprehensive shoulder course focusing on shoulder repair and reconstructive surgery. Shoulder 360 will always continue to redefine the way we think about surgical education of the shoulder. They focus on new methods to engage attendees, encourage participation, and utilize new educational technologies for a more interactive experience. There is no death by PowerPoint here. Shoulder 360 aims to educate the spectrum of healthcare providers caring for patients with shoulder disorders. The target audience is practicing surgeons, surgeons in training, nurses, physician assistants, and physical therapists. Shoulder 360 wants participants to learn about the newest and best ways to treat their patients while enjoying a setting designed to foster lifelong friendships and collaboration. Trust me, the venue is awesome as well. Don't forget to use our promo, OrthoShow10, that's ORTHOSHOW 10, the numbers for your 10% discount when registering. Okay, we're back and we're just having some great episodes. This is an amazing educational episode with a fellow entrepreneur, Dr. Reza Jazayeri, also known as Dr. Jazz, who is an orthopedic surgeon out in Los Angeles for Kaiser Permanente in private practice. About 5 years ago, was starting to talk to one of his patients who was a NASA scientist about nutrition and what they were doing for the astronauts. And a bell went off in his head and he said, wow, nutrition is something that we should be doing in surgery. And he spent the last 5 years building this company and the concept and the idea that nutrition is an unmet need in surgery. It's truly a fascinating episode on something that I think is so important for all of us to learn, whether you're an orthopedic surgeon or the mother of an orthopedic surgeon or anyone else. This is a great episode. There's a lot to learn. I know you're going to enjoy it. Dr. Scott Sigman, #FollowTheFro.
From Medical Media, this is The Ortho Show.
Hello world, Dr. Scott Sigman, your favorite opioid-sparing orthopedic surgeon here for another episode of the Ortho Show podcast. We are so excited, as always, to bring the best of the best in orthopedics. We are the voice of orthopedics. We have one of my Curlin Joe brothers on this week, Dr. Reza Jazayeri, but we're going to call him Dr. Jazz because that's what everybody does. He's an orthopedic surgeon in private practice out in Los Angeles, in the Valley, down in Woodland Hills, next to one of my favorite wine stores of all time. And he's working now out of Kaiser Permanente as well. Dr. Jazz, what a pleasure, man. Thanks so much for joining us.
Thank you so much for having me, Scott. I got to tell you, it's really fun to be here. And, you and I share a lot of, similar pathways. So I'm excited to talk to you and kind of dive into all this.
Yeah, no, it's great stuff. So, man, we always start at the beginning, where, when, and why, because your story is pretty cool as to, how you got into orthopedics, because it wasn't that way to start. So give it up and let our listeners know all about you.
I was actually born in Iran. My parents left when I was 9 with the revolution and all the crazy stuff. So, we left when I was a kid. Fortunately, I had a couple uncles in the States. One was an orthopedic surgeon, one was a neurosurgeon, who we kind of stayed with until we thought things were going to get better. It didn't. So, we ended up staying out here. And so my mom and dad, they're both kind of scientists. They're PhD science people. And I kind of had the background with science, but medicine wasn't something that I thought I was going to get into, actually. I was actually into racing cars, and I had my uncle who they work for Honda Motorsports. So at the age of 14, 15, I got into kind of working with my hands and kind of putting things together. My mom got so freaked out because I was actually going to go into this, send me to New York to hang out with my uncle, who would kind of maybe introduce me to something else, and drills and screws. And he was a spine surgeon doing posterior fusion. And at that age, I was like, wow, you can use tools and work with people. And so that's what kind of changed things for me. And I kind of got into medicine and orthopedic surgery through the experiences of, my family and uncles and mentorships like that. But that's how it started.
Yeah, it's funny. There's not a lot of kids that get a lot of positive response from their parents when they say they want to be a race car driver. And
Yeah,
if, if everybody's gotten into F1, I mean, these kids, they're kids now. I mean, they're in their 20s, when they're driving these F1 cars. To really get into it, they start really young. I mean, you really have to support. It's very expensive, and they got to get the training. But at the end of the day, it's like if you come from a family of doctors and scientists and PhD people, probably racing cars is not going to be one of the accepted occupations.
you know what scared my mom and dad? There was a bad fracture and they needed an X fix, and I was like, "What is all these? What's going on here with all these like instruments and this thing come out of his leg?" And that was kind of what kind of put a little fear in me, but also kind of gave me this, like opportunity to say, "Hey, look, there's something we can still do with tools, but help people." And that's how it kind of opened up my eyes to thinking outside just racing.
Yeah, no, that's great. I mean, having family members who are in the business certainly helps to be able to identify the pathway for sure. So you figure it out. You decide that racing cars. Nick Kolovas, who's one of our alumnus, actually still races F1s. I got to give him the shout out. He
Yeah,
actually had two cars, one in Europe and I think one in Mexico. What a crazy Michigan story he had. But we love sharing all of our stories. But you finally figure it out. It's going to be medicine. It's not going to be racing cars. And then it's college and then Albert Einstein for medical school. You're going to head to the East Coast.
yeah, and I'll tell you just something that kind of to build on this story where how things kind of came back. I started out initially thinking that I was going to do like a exercise physiology and metabolism for my pre-med. I wasn't just all into the just doing like the biology basic stuff. I had a little interest because I was into sports and athletics. So I did a lot of research in skeletal metabolism and just kind of understanding how the body works and kind of tweaking it was not that dissimilar with trying to figure out how the car works and, understanding to improve performance. So that's always kind of been in the back of my head of kind of trying to figure things out and then improve on the performance. And so skeletal metabolism, understanding how the body works, even as an athlete myself, I swam, I did water polo. Having that deeper understanding has always been something I was fascinated in, which ended up kind of coming back 15 years later to kind of being able to tap into that again.
Yeah, we get a lot of tinkerers that wind up going into orthopedics, whether it's biomechanical engineering, but that sort of, left brain, right brain thing sort of works well for a lot of the things that we do within orthopedics with screws and drills and joints and all the things that we
Yeah.
do, which really get us going. So but you had grown up in from the age of 9 in Southern California, is that correct? Or
Yeah, yeah. I grew up in California. I went to Einstein for med school in New York. That's where my uncle was at. In New York, was a neurosurgeon. My other uncle in California was like, "Yeah, go to New York. It's a great experience." Loved NYU, so Einstein was for med school, and I was doing my research in spine. I thought I was going to go into spine, and then the surgeons were cool, but the patients were challenging to take care of, and sports was kind of the something that was I became really passionate with, and it kind of was fun. I loved the patients, and the cases were cool. So that was kind of what I kind of shifted towards.
I'm trying to think, when were you at Einstein? What were the years?
2000 to 2004.
Yeah, so one of my dearest friends, Todd Foreman, his father was Spike Foreman, who was the CEO of Einstein, but he may have retired, I think, just before you had gotten there. So you may not. So
Yeah,
Spike Foreman,
yeah.
does that name sound familiar to you at all?
No, yeah, I don't know that name.
Yeah, no. And then did you get some time with Plancher while you were there too?
Yes,
Or
yes,
no?
yeah,
Of course you did.
yeah,
There you go, Kevin, right there, baby. Ortho Summit
yeah,
swag, throwing some love out your way.
yeah, for sure. Yeah,
So,
Kevin's awesome.
so Kevin, as a sports expert at Einstein, would have been someone that you had spent some time with. But I guess you got enamored by the whole New York scene. You had a hard time leaving, so you
Oh my
decided to
God,
do
yeah.
residency right there as well.
Yeah, I was very fortunate to be at NYU at that time, Hospital for Joint Disease. Now it's Langone, but it was an incredible experience. I mean, the mentorship there was awesome, and they let us really be involved. And we had a very wide spectrum from taking care of the Bellevue patients that you're really involved to the other side with the NYU Tisch patients, and it was a fantastic experience. I was also fortunate to go down to Tampa and work with Mark Mile and Mark Frankel, and because I was interested in shoulder arthroplasty as well. So the my residency experience was really great.
So Mark and I graduated medical school together, which is yeah,
Really,
I just sent
Mark
it
Mile
into
or Franco? Which
Mile.
one? Oh, Mile.
Mile.
Yeah, he's great.
Yeah.
Yeah.
So I just sent the picture to our medical school alumni magazine. So we'll see if it hits.
Yeah.
But Frankel obviously is the father of American reverse
Yeah.
arthroplasty, and
Yeah.
we still have his episode on archive. We're ready to send
Yeah.
it out pretty soon. But that was a fascinating conversation as well. And Rob Mislin must have been in practice
Oh,
at the time.
Meisner, he's one of my, when you go to residency and you go through your training, and even till today, you take pieces of people that you're like, I want to be like this guy. This guy does, and Meisner, one word I would just slick. He's very slick. He's a very good surgeon. He's just good with people, and he's one of those guys that I definitely hope to take a piece of his style into my current practice.
Yeah, no, he is. That's a great way to describe him. He's still in practice and still doing great stuff. And we just sent a picture. One of his friends was at the conference with a dinner with us the other night when we were talking about the Bear ACL.
Hmm.
And his name came up again. So name droppers, we love doing that. So you spend your time at NYU at the Hospital of Special Surgery. I'm sorry, for joint diseases. Now it's called NYU Langone, and it's back to the West Coast, brother. You've been away for a while now,
Yeah.
but it's time to come back home and you do your fellowship at Curl and Job. So when were you at Curl and Job? 2009 to 2010.
Yeah, I was lucky. That was the year the Lakers beat the Celtics. I got to watch Kobe, come back, and it was an epic game, really. And for me, especially growing up in LA, to be back uh, at Curl and Joe with the Lakers, that was an awesome year. And I think we all have great memories of our fellowship year, and that Curl and Joe, you went through that experience, and it's more than just the operative experience. It's the experience that you get dealing with professional athletes and really taking care of patients and understanding what it takes to and have the skill set to take care of those athletes. It's
And the
incredible.
quality of the faculty there, it's a bunch of retired at this point, but Ron Cavitney, Ralph Gambardella, Steve
Yeah.
Lombardo, Clarence Shields, Lou Yoakum. I mean, just titans of sports medicine. I didn't get to
Yeah.
everybody, including Dr. Job
Yeah.
and Neil
Yeah.
Elatrage and
Of
all the
course.
crew that were there at the time, for sure.
Exactly. So we're very fortunate to have kind of this opportunity to work with these amazing people, and I think we are where we are because of the people who helped pave the path. And and I got to tell you, Scott, even with you and I, you're probably 12, 13 years maybe ahead of me. But like I'm very fortunate to have guys like yourself to have kind of have the vision and the ability and the balls really to kind of push outside the box. And, the other night we're at that meeting that you were talking about, the Bear implant. I remember when I first started doing ACL repairs 8 years ago, people were like, what are you doing? And, in the last 8 years, I've done like 32. So it tells you, it's not that many, but still, even then they were like, what you're going outside the box here. And most of the guys who were, criticizing me for doing anything new were, the guys who were a little bit ahead of me. So to see you with more, gray and white hairs than me, pushing the envelope, I knew you tried the arthroscopic ladder J. Like I'm kind of the same way, try to push the envelope. But then having someone like you go through KJOC and be an entrepreneur. So I just want to say I'm grateful for you being who you are, because you're helping guys like me, say, hey, look, there's an opportunity to do this. So thank you.
Oh, no, you're welcome. It's a great legacy. I mean, my Curl and Joe, diploma has opened up more doors in my 30-year career than probably any other single thing that I've done in clinical practice. You brought up Kobe and the Lakers beating the Celtics. And one of my favorite Curl and Joe stories was from Steve Lombardo. And was Steve still practicing at the time?
Yes. Oh yeah. Oh yeah.
So
Yeah.
My favorite line from Steve was, he's like, Scott, I just want you to know, when this whole NBA thing started, I drove a nicer car than the players.
I believe that story. Absolutely. That's Lombardo for
Not
sure.
so much anymore. Not so much
Yeah.
anymore. That's for
Yeah.
sure.
Yeah. Yeah.
Well, look. So let's talk a little bit about something that both you and I have passion for, and that is we're both entrepreneurs. We got together. You brought up a story which I want to give a shout out to Hafiz Kassam and OC Shoulder. he had me do a nice little talk on entrepreneurship, and I think that's something that you and I share. And I want to talk about what you've started and the passion for why and why it's important, and that's accelerated recovery. Tell our listeners a little bit about what accelerated recovery is and why you've decided to start it.
So Accelerated Recovery is a science organization of orthopedic surgeons who've come together. We put together a nutritional supplement to really help enhance the recovery process. The way I got into this, I'll tell you the story. I had my practice. I do a lot of revisions. I do a lot of osteotomies. I'm doing infected cases, revisions, and part of my practice is kind of trying to understand what am I going to do different than the last 2 or 3 surgeons, and it's oftentimes not the implant. They've done the implant, and I started to kind of think, well, why isn't this patient healing, or why are they having this persistent infection? And so it starts to look at the patient factors. And so I'm in a big organization at Kaiser. We have a lot of data to look at, and I start to see, the albumin was not ideal, just like, if they're diabetic, we treat that, but the patient's nutritional status started to become more and more apparent. And I started to realize, as surgeons, we're really, really good at like honing in on our skills, right? Like you went to France and spent months to learn how to do an arthroscopic Latarjet, but it's still the Latarjet. It's still surgery that was done many years ago, and we're still refining that technique. So we're really good at being kind of focused on the operative skill side. We've really overlooked this additional side, and very important side, which is the kind of the patient themselves, right? And so actually Rafi Mirzayan, who's been similarly on this concept with me, he gave a very good analogy. He's like, look, as surgeons, you don't want to just be taking care of the branch, fixing the branch that's broken. You got to take care of the soil and the roots. And so this is where the nutrition is coming in. And again, for me, having the background on skeletal metabolism and looking a little bit deeper, we talk about, patients have poor protoplasm, right? So what is it about the protoplasm? What can we do that we can address this? And the reality is, as orthopedic surgeons, we were never taught anything on nutrition. And so I actually took a sabbatical on this. And what really triggered me is I had a patient about 5 years ago. He came in, I did a revision ACL on him. He needed an osteotomy, actually. He came back, everything was fine. But he says, Doc, what do you have for my leg? I've lost, my stability is good, but I got this skinny leg. What do you have to help stimulate the muscles here? We talked about some supplements and, taking protein and all that. And then he kind of like sat back and said, Doc, I'm kind of disappointed. Aren't you aware of all the amino acids and all the nutritional stuff that's available now that we've been utilizing in NASA? And I said, wait a minute, whoa, what do you know? He goes, look, I've been on the nutritional team for NASA, and we've been at this for almost 20 years. And I was just kind of sat back and said, what are you talking about? He said, look, when we go to outer space, there's the issue of muscle loss and bone density loss that happens very quickly because of lack of gravity. So then, a busy clinic, I went home that night talking to my dad, who's a PhD in like chemistry. And I said, Dad, I did this great surgery on this guy. He did fine, but he's freaking schooled me because I didn't have what he thought something, a skill set or knowledge that I should have. He goes, hey, call him back and figure out what he was talking about. And let's try to see what we can do here. So I called him back, and this is about 5 years ago now. And so we called him back and said, hey, look, John, I think it was really fascinating what you were talking about. I'd love to learn some more. That was it. And I just got into the research and took a sabbatical after that, understanding, hey, look, there's something we can do here. And as orthopedic surgeons, because we didn't have the time, we don't even have the time to even take care of our own patients, besides go outside and learn something new. So this is how I kind of got into it. And we brought in people from burns who were looking at burns and saying, hey, these patients who are getting supplemented with the right nutrients are healing faster. When I looked at those burn patients, I said, wait a minute, that's collagen. Collagen, whether it's an ACL or rotator cuff or augmenting an ACL repair, we need collagen. We need the biology. So I think this is where I'm really excited to kind of see the results coming back now. But it kind of really started as a patient reminding me, hey, there's more to the body than just the screws and the instruments. There's a whole metabolic portion of it that we can address now, and not just be kind of the carpenter, but maybe more the gardener, right? Where you take care of the soil and you take care of the entire kind of
Yeah, I
patient.
mean, I think it's a great point, and we as orthopedic surgeons really get focused on the things that we do. But at the end of the day, we're the tip of the spear, and if everything is not right on the inside of the body, complications can occur, outcomes aren't as good as we want them to be. And nutrition, I think, has become up until recently really the unmet need in surgery that's really not discussed. So kudos to you for taking the time and the energy to really focus on this. For our listeners, when we talk about albumin, that's just it's a blood test that we can do to determine how the proteins and stuff are going on in your body, to determine whether or not you have the building blocks to be able to heal and do the things that we're doing. A successful surgery is when we take a problem, right, that isn't getting better. We then operate on you and we create a problem, knowing that the problem that we've created should heal and get better, and then you get better along with it. But if you don't have those building blocks, so I mean, it's really, you think of essential amino acids, and we'll sort of do a little bit of a dive here for the listeners so they understand.
Sure.
But you also talk about collagen. I mean, what's within? So give us what's in the package. What do you give patients from
Sure.
accelerated recovery to help them get ready for their upcoming surgery?
Okay. Let me back up just for a minute, just to kind of give an overview of what we're dealing with, and then we'll kind of dive in so it kind of makes sense. So the body is made up of about 20% all protein, 60% is water. So our fundamental structures, whether you're talking about muscle, bone, enzymes, any of our tissues are essentially made out of protein. So this is our requirement to kind of understand that. Now, protein itself is made up, our entire proteins, we have over 100,000 proteins in our bodies. Okay, these proteins are made up of only 20 amino acids. Okay, so think of it as like an alphabet in our dictionary, right? So you can take these words and you can combine different words to make up a different sentence with a different meaning, right? And these amino acids, there's only 20 of them that we can make all of our entire body. Of these 20 amino acids, some of them our body can make themselves. Those are called non-essential. That means your body can actually synthesize like Lego pieces and make it. But there are a few, 9 of them, that are essential. What that means is your body cannot make them. It means it has to come from the outside source. And when you're going through a time where you're having a burn, a trauma, a fracture, your body needs to have these amino acids available in order to create the muscle, the recovery, for the collagen, for the bone. So these essential amino acids play a very important role in our evolutionary kind of health. And so if you go back when you and I were cavemen and we broke our leg and there's no food around, there's no hospital around, we still survived. So how were we able to survive? Well, we all know we have fat as a reservoir for fuel, for energy. But when you break your bone and you have some kind of trauma, your body says, well, I still need some of those building blocks. And unless you're getting it from diet, which oftentimes you're not, your body says, no problem. I'll tap into my own reservoir. Where is that? Your own skeletal muscle. So your body will harvest its own skeletal muscle because it has those amino acids to then be able to heal your wound. So as opposed to letting our patients go into surgery completely fasted and say, hey, we're going to do outpatient surgery and we're going to cut into you, we're going to open you up and then go out there and heal, we're spending so much time with the implants, we're kind of overlooking this low-hanging fruit that's saying, hey, look, if we're going to help you heal, why not give you exactly the amino acids at the right dose, at the right formulation, at the right time that you need to have this on board so you can heal faster. So that's kind of the overarching view.
Okay, absolute A++, frotastic, description. So my mother, Judy, can understand why nutrition is so important when it comes time to surgery. So instead of you breaking down your own muscle and fat post-operatively, what we're going to do is we're going to give you these essential amino acids so your body has those building blocks to be able to heal what we've just done. That is really Dr. Jazz, man, you got me all excited. That was fantastic. Really, really appreciate that. So basically, a week or two prior to surgery, you guys can put together these essential amino acids in a formula that people can ingest to be able to get themselves ready for surgery. So tell us about that.
Correct. So I approach all my patients like an athlete going to train for a competitive event. You don't have a athlete who's going to run a triathlon go into their triathlon, their event, without preparing physically, emotionally, and nutritionally before they get ready for that event. And the night before surgery, actually the weeks leading prior to surgery, you modify their nutrient kind of intake, you do carbohydrate loading, and you get them ready for surgery. And, these athletes are not going to go into their event fasted. That's crazy, right? You're not going to have someone try to go through that stressful event without having any fuel on board. But guess what? That's exactly what we're doing to our patients, right? We're telling our patients, please don't eat. By the way, this is all modifying now. So accelerated recovery is not just an amino acid kind of formulation. There's way more to it than that. And the other component is also the carbohydrate loading. So we have a whole program that gets patients ready, and we load them before. And there's a lot of good research by Hans Dreyer and some of the other guys who've been at this for some time that have shown that on a cellular level, by loading patients up prior to surgery, you improve their resilience. So when that surgical impact hits, you have much more of a reserve. You still have a hit, but it's not as low. It's not as deep. And so what ends up happening is if you look at the recovery rate of athletes, if you can preserve their muscle at that early phase, and we're learning now that the first 2 weeks after surgery is when you're the most catabolic. So if you can mitigate that hit, that's reflective of how these patients are going to do 2 years down the line. And this is really fascinating, even more for elderly patients. I mean, look, a hip fracture patient, 30% die, right? And that was the other thing I'll tell you. So my grandma was a super active woman. She had a hip fracture, and literally in 6 months she died. And I just couldn't, I was still, in high school at that time, but I couldn't just imagine what happened, just wasted away, And I really wondered, like, what could we have done differently if we had optimized her, right? If we got her moving faster, if we got her we got her better nutrients in. Patients after surgery don't have an appetite, which is even worse. You're just kind of eating away your own tissue. So this is kind of now our responsibility to say, hey, look, it's not just about I'm going to put a screw in or whatever, but let's step back, optimize the patient. Sometimes I actually hold off on surgery. I check my patient's nutritional status. Say, look, if you're infected, but you still have poor nutritional status, you're not going to do well. So I hold off on all my elective cases, even my rotator cuffs now. Everyone above age 55, I check their nutritional status by albumin. We do some questionnaires. If they're not optimized, we say, hey, look, just like diabetes, you say, look, you're at risk. Let's hold off. Let's optimize you. Come back in 2 months, 3 months. You're better. You're stronger. You're healthier. Now let's do your surgery. The chance of a rotator cuff repair healing is much better when a patient's optimized. No question about it. And we're seeing the results now come out of them. So I'm really excited. These next couple of years, we have 4 clinical studies in the works, and we'll be looking at the outcomes of these interventions.
Innovation requires courage to change, especially when you haven't been taught this in your curriculum of the things that you do. So I know this all too well as the laser guy, trying to convince doctors about new concepts and ideas. And I think that, what you're onto here will hopefully become mainstream and almost should be mandatory. If I were a commercial insurance company and I'm worried about a failure rate of 20% for rotator cuff surgery, why am I not making sure that the nutritional status for this patient is up to speed so that the outcomes are going to be good for the patient? And it takes a lot of energy, right? And I know.
Oh my God, yeah. I mean, that's why I got to tell you that when you gave that talk at the OC shoulder course about entrepreneurship and orthopedics, that really resonated with me, because I was like, man, we got only like 12 hours of nutritional education in med school and residency. I mean, I don't know about you, Scott, but the only thing I remember in residency about nutrition was make sure I keep everybody MPO so I don't get a beat down from my chief resident, so I don't cancel a case.
And the fact that we couldn't eat because we were working too hard.
Yeah,
because, we weren't on an 80-hour work week back then, that's for sure. But
right. So I think it's definitely been, and actually you brought this up as well when we were talking about the bare implant, and you said something that really stuck with me. You said, look, you can do this technique, this procedure, and it's implant agnostic, right? It doesn't matter if you're using, tightrope or this or that, screw or button. What you're what this what the bare it's really this biology that you're bringing in. This is not another different kind of screw, right? It's biology, and this is exactly what XR is. It's agnostic to actually any procedure or any subspecialty. We're talking to some of the spine guys who we're going to be doing some studies with, and some of the hip fracture guys, and some of the ACL people, and so we're like, I think this was going to help different people differently. And so I think the elderly patients who are traditionally unhealthier, they have less muscle mass to begin with, they're going to benefit quite a bit. And I think we'll see things in mortality even be affected by this, and complications or morbidity. I think our athletes, they're not going to die from having an ACL surgery, but we see revisions needing to happen because athletes go back too early. They don't have enough muscle mass to protect them, and they get re-injured. So I think we have different challenges on different ends of the spectrum, but this enhancement of the patient's biology and intrinsic ability to be able to heal is really something that applies to all our patients.
Yeah, there's no playbook when you start a company from scratch. I can recall sitting in Panera, writing down on a napkin with my partners about, starting OrthoLaser, and I sort of listened to your conversation with this NASA, specialist who was a patient of yours, and then you literally take time off out of your life and career, providing sweat equity, right? They're not making a lot of money on these things, but
No.
it's, but it's the idea and the concept of generating energy. And then you have to develop consensus, which I commend you. You've got one of the OGs, Joe Zuckerman, from your time at residency. You got Neil Elatraj, Bert Mandelbaum, Rafi, Paul Sethi, Idem Europe, and there's a bunch more that are part of your crew. But, you're bringing on board these people that believe, in what you've come up with to be able to help generate this, and then hopefully really change the way in which we do medicine. And it's a mission. I really hope you succeed, and I hope that your company takes you to the next level and you get an equity, exit. But more importantly, what you're going to be doing is helping so many patients to be able to heal and get better. It's a mission. It's not mercenary. It's missionary. And I commend you for the time and energy that you put into this project.
Thank you. I really appreciate that. That means a lot. And honestly, that's the most exciting part, is being able to kind of, be able to educate myself, and then be able to kind of take this to the next level. And I think shed some light on something that, it's not that we don't understand it. We just don't have the time and the resources for it. And I think, and it's not something that necessarily I even want to say I created. I've really I just took the time to put it together. I mean, the research that NASA has been doing, these guys like Robert Wolf, this is someone who I studied. He spent 30 years of his life. He's a PhD guy looking at muscle metabolism and protein, and what is it about protein? So, we talk about, like, for example, protein, or like what's in, what is it in protein that matters? These astronauts couldn't take food with them. So they said, okay, well, we can't take chicken or steak or whatever. Well, we still need protein. Well, why do we need protein? Oh, it's the amino acids. Well, which amino acids is it? At what ratio and at what dosing? So these guys have done this on the muscle loss side because of, the issues with NASA, but then sarcopenia, just elderly aging, applies there. And then when you tap into the patients who are taking care of HIV patients and burn patients and diabetic wound ulcers, the science has already been done for almost 20, 30 years. It just kind of took someone who saw these patients just like you are, but then had kind of the interest in time to just kind of really put it together. But now taking it to this next level, this is where kind of the challenge is getting people on board. I'm excited. We have an instructional course lecture that's coming up at the Academy that we'll be discussing this with a lot of people who are involved. There's a yellow journal that's coming out, and I think in the next, and look, we're all very skeptical as surgeons, and this is how I kind of got into this. I kind of poo-pooed all this stuff, and I said, look, as opposed to like kind of looking the other way, saying I don't know, that guy really got to me. I was like, I should know this. I should know this. And so and we have now with technology and the stuff that we're doing now with body measurements. We're checking patients' body composition with BIA, which is bioelectrical impedance analysis. I mean, really quickly, without that much cost, you can see patients' body composition changing, and for the most part, when they're not supplemented or they're not being optimized, they just drop. So I think in the next couple of years, with good science and good literature, then we can really take this to the next level. And I agree with you. I think this will be something that will be standard of care, because unless you address it, you're leaving a low-hanging fruit that can cause a lot of complications. And there's been a recent paper came out looking at the cost savings based on previous work that's already been done on amino acids, and it's about $316 million a year just in trauma patients that our system would save. So I think there's a lot of work to be done, but it's exciting as we try to get through it.
Yeah, you've got the classic entrepreneurial spirit, which is, you don't have to be the person to create the widget or even to understand the science or create the science. But what entrepreneurs do is they identify a problem and then they look for a solution, and then they bring people together and develop consensus, and then try and breed success and change whatever that problem is to the solution.
Look, this is what we typically see. We see an athlete that gets injured; they lose about 20% of muscle just from their injury. Then you and I try to do a good job stabilizing them, repair, reconstruction, or whatever, but they end up with a leg that looks oftentimes like this. And so graphically, this is what we're looking at, Scott, is really thinking about, on the blue, you got the ACL. This is the best case scenario, 18-year-old, right? They get injured. They lose muscle just from the immobilization, decreased mobility before surgery. They take a hit. And then we know that it takes even up to 24 months until they're back to full other side. Sometimes they never get back. We allow our athletes to come back somewhere around here, but this is where we see a lot of the issues with re-tears. This is a problem with a lot of our young athletes. When they go back too early, they don't have enough muscle to really protect them, and this is a potential role for re-injury. This is the best case scenario. Joint arthroplasty, total knees. I mean, these guys have a bigger hit; they take forever to come back, and then the hip fractures, like we discussed, 30% have mortality here. So this is what we've learned is this is the most opportune time for us to intervene, because this is when you see the most amount of catabolic stress. The reason to start a week or two earlier, and so some of the studies that we're looking at, we're going to start supplementation 2 weeks before to kind of build up the resilience, but definitely make sure you have something on board, because the first 2 weeks after surgery is the most catabolic. So this is where I think we're honing in on to be most effective.
So first and foremost, Gracie, yeah, I think Dr. Jazz here is going to give you a run for your money on production.
Sorry, it was just easier to get this point across.
No, I love it. We have video too, so
okay,
on the YouTube channel, it'll be important to show. It's all good. But again, for our listeners, I thought that was a really great sort of point. So again, for my mother Judy, the problem is you get injured, and when you get injured, what happens is you get some injury, you get wasting, the muscles and things aren't building up, they're going down, and then you go NPO, you're not eating or drinking around the time of the surgery, and then you have surgery, and then you're still not eating the way you would have previously. All of this contributes to the lack of the ability to make new tissue to be able to heal yourself. And the concept and idea with XR is to provide the nutritional supplements to make up the difference that should have been happening that your body couldn't do at the time of injury and surgery. Reza, this has been incredibly educational, for our listeners, which are orthopedic surgeons, as well as just a lot of other people on the planet that are interested in the stories that we tell. Your passion for entrepreneurship is something we share. We're Curl and Joe fellow brothers of another mother as well. I just want to say I'm very proud of you for identifying a real unmet need in surgery and the things that we're doing, getting into a very uncomfortable spot, learning and identifying things that you weren't trained in, but being able to bring consensus and build this thing. And we really wish you tremendous success with XR and your clinical practice. And we can't thank you enough for taking the time to be on the show with us today.
I appreciate all the kind words, and I appreciate you having me. It's been exciting. Thank you.
Yeah, no, it's my pleasure. This is Dr. Scott Sigman, Hashtag follow the fro, host of the Ortho Show. Till next time.